Did you make a New Year's resolution? We all did, of course, right? Well, I didn't this year, actually, Doc. Dr. Richard Chaffoo is here with potential dangers for those health-related goals. Good morning, first of all. Happy New Year.
Happy New Year.
Everybody wants to get healthy in the new year. You know, the gyms are packed. Even outside, everybody's running and riding their bikes. You have to know when you're making these New Year's resolutions to take it easy. Don't do everything all at once, right? What's the best advice you can give folks?
So Raoul, the best advice you can is not to be too hard on yourself. You know, for weight loss, a very important thing all of us, you know, we want to lose weight, we want to exercise more, stop smoking for those that smoke. The big thing about weight loss is you put the weight on slowly. So that's the best way to take it off, Raoul, because it's not just actually the amount of weight you're losing, is a lifestyle change, so you keep it off long term.
It's how you lose the weight. That's excellent. Does weight loss work would be the question, but it's like you said, you could lose 10 pounds in a week, but if you gain it all back, then what was the point of doing that in the first place,
Exactly, and that's the problem. You know, these rapid weight loss programs that people do where they'll lose like 15 to 20% in 2 or 3 months, there are some health risks associated with that.
Yeah, that's not good for you.
No.
The risk involved what? Like if you're sitting there and it's January 1st, you get on your diet, and you lose 15, 20 pounds, like you said, in a couple of weeks, what can that potentially do to you?
So potential issues are their associated increased incidence of gallbladder disease, problems with malnutrition because your body begins to eat its own protein, hormonal imbalances, electrolyte imbalances, hair loss, change in menstrual cycles, irritability, loss of concentration. So a lot of physiological changes can occur to the body when you're losing weight too rapidly.
And I mean, the side effects, I think if people knew more of the side effects, they probably wouldn't try to get, because there are so many of these diets promise. Why do we continue to have these commercials and programs that promise to lose so much weight so quickly?
Well, the reason is, unfortunately, the dietary supplements are not treated as medications or drugs, so they're not regulated by the FDA, and they can market and say whatever they'd like to say.
I'll tell you what, I started riding a bike three years ago now, and it's just the steady, slow drop in the weight. It works wonders, and it changes your lifestyle and everything else,
It increases your serotonin level, a feeling of more, you know, feeling better.
That's the way to do it. And it takes a simple walk. 5 minutes, 10 minutes, something like that. The best way to give up smoking, a lot of people out there saying, I'm going to quit smoking. My dad quit smoking after 40 years.
Wow, that's wonderful.
Yeah, and it took the patch. Remember back in the day, the patch and all that stuff. What's a good tip for folks to try to quit smoking?
So the good tip for people that stop smoking is you really can't do it gradually, Raoul. You can't, you know, if you're smoking a pack a day, you can't go to smoking half a pack or a few cigarettes, because we know nicotine is highly addictive. As you said, there is their patch, there are some medications, but probably the best thing is cold turkey. That's probably the best way to get it, because it's such a powerful addictive drug, nicotine, that's in tobacco.
That's hard to do. That's easier said than done.
It is very difficult to do.
Wow. The patch still works?
Yes.
People use that? Wow.
Some people still do.
Healthy New Year's resolutions. Doc, we need to have some big changes so we can can I eat more salad, maybe no dressing? Or what do I do? I need some healthy resolutions.
So a healthy thing is don't skip breakfast. Really important meal of the day. Exactly. Because the studies have shown that people that, that skip breakfast are more likely to be obese, have diabetes and heart disease. So you want to miss a very important meal. Your blood sugar drops after you've been, you know, without food for 8 hours. We've shown there's decreased attention span, memory, learning.
We wake up early though. It's hard to get up and make. So what should eat right when we get to work, or what do we do in our shift?
Exactly. So maybe have something prepared the night before and bring it to you when you come.
Tell you what, we need to have you here every day. You're like a good life guide to what we need to do. Doc, Happy New Year. Thank you for being here. All right, let's get you over to Heather.